Thanks for studying with me today. Today we're talking about low back pain, and this is coming out of your Davis text, chapter 37. Now, according to the National Institute of Neurological Disorders and Stroke, back pain is the second most common neurological ailment in the United States, and it affects both males and females equally. And at least 60 to 80% of the population will experience low back pain at some point in their life. So wherever you're at in nursing, you're going to see people with low back pain. And unfortunately, this can be rather debilitating, with 10 to 40% of patients' symptoms persisting over 6 weeks long. Now, there are a number of causes of low back pain, and they can usually be divided into three categories. Spinal degeneration, that's kind of like the wearing out of an old tire. Eventually, those tires wear down, they get thinner, and there's less cushion on the tire, and so then it causes the tire to need to be replaced, but we only get one spine. So spinal degeneration is kind of the wearing out of the spine over time, so we're going to see that more with the elderly patients. Spinal stenosis is the narrowing of the canals and foramina in the spine, which causes constriction and pressure and tension on those nerves. And then finally, and probably the one I see most often in nursing, is muscle spasm, where someone's picking up something heavy and they throw out their back, causing a muscle pain and spasm. The muscles spasm to protect the body from further injury. So when the muscles feel like they've been overworked and they're injured, they spasm and clamp down to protect themselves and heal. But that spasm can be extremely painful. So you can see in this diagram that there's different types of low back pain and disc degeneration over time in the spine. So you can see here a nice healthy disc, intervertebral disc that is lubricating the spine and cushioning those bones and protecting the spinal cord within. And then you can see over time that that spine gets worn down like an old tire, that degenerated disc. So there's less cushion, and so that can cause pain. You can also see the discs starting to slip from where they're meant to be out into the space right here. And so we see the bulging disc or the herniated disc, which can cause excruciating pain and sometimes require surgery. You can also see the disc thinning, and you can see disc degeneration with osteophyte formation. And this is where the bone starts to try to grow new bone and even fuse together, which can cause a lot of pain. And here you can see how bone degeneration or spinal degeneration happens over time. So in this first upper left image, we see a healthy spine with healthy discs and plenty of space, and the spinal cord is there, nothing's compressing it. And then the first step of this spinal degeneration is the loss of curve and reduced range of motion. So we start seeing micro tears in that disc, and the disc gets thinner. And then as that happens and there's less cushion, we see the disc not having anywhere to go. So it bulges out and pushes against the spinal cord, causing pain. And that also causes nerve root compression, which causes pain and eventually will cause nerve atrophy. So then you can see that as the discs narrow, bone spurs or little bony growths will start to grow, and that disc will herniate or extrude into the area of the spinal cord, causing additional compression on that nerve root. And then eventually that can cause spinal nerve atrophy, where the nerve itself is impinged so much that it's no longer working very well and shrinks in size. And we can see loss of bone height, which is why we see people actually shrink a little as they get older, because there's not those nice cushions in between the vertebrae. And then these bone spurs and the lack of cushion means bone on bone, which is a really uncomfortable and causes a lot of pain over time. So spinal degeneration, of course, happens over time, happens slowly and gradually, whereas a muscle spasm, like if you lift something too heavy, those symptoms will come on acute and very quickly. And so, or if there's a bulging disc, that can also happen quickly. So clinical manifestations of low back pain include acute pain and muscle spasms. And there are a number of different tests that the providers can order to determine the problem with the spine and if there is a herniated disc or a bulging disc, or if this is just musculoskeletal pain. One way to tell if it's musculoskeletal is the pain will be reproducible with a certain movement. So if you lean down one way, that's always going to cause that pain. And then diagnostics will include a history and examination. What were you doing before the pain happened? Do you have a history of this? And then there's a number of diagnostic tests that are listed here. They're on page 817 of your Davis book, and I encourage you to take a look at that and read through some of the descriptors of these more specific tests. The most common, of course, would be X-ray or CAT scan. X-ray is cheap, cheerful, easy, accessible, and so it's often the first step providers will do, but additional and more expensive testing may be required if there is some spinal degeneration or bulging discs that they need to see further. And on page 817 of your Davis text, it talks about both non-pharmacologic and pharmacologic options for low back pain. So pharmacologic options include things like Tylenol and NSAIDs for pain and for inflammation. Muscle relaxants if there's a muscle spasm. Opioids for severe pain. Systemic corticosteroids to help reduce any inflammation from a muscle spasm. And then even things like tricyclic antidepressants and benzos can help if there is some kind of nerve pain. Additionally, non-pharmacologic options are very important in the treatment of low back pain. And your book talks about a number of things like superficial heat and massage and stretching, and making sure that the patient doesn't become completely immobile because that will make the pain worse. They need to keep moving, but be careful not to lift heavy objects and be mindful of the body mechanics that they're using to move around. Now, when it comes to the spine, you have to have a specialist who knows what they're doing because we're talking about nerves and spinal cord injuries, and you have to be really careful on how these patients are managed. There are some interventional therapies that neurosurgeons and spinal cord specialists can do. These include nerve blocks with local anesthetics, steroids, and narcotics that are directly injected into the affected area. They can also use TENS units, transcutaneous electrical nerve stimulation. These are little stickers that are put on the outside of the body, and little electrical impulses are sent through, and the patient will feel this tingling sensation. And TENS units are great for musculoskeletal injuries because they disrupt the nerve paths and kind of confuse the pain nerve receptors. And so the patients will experience a decrease in pain as they feel this kind of just tingling sensation in the muscle. And then, of course, there are spinal surgeries that are indicated if the patient has severe degeneration and immobility. But there are risks with spinal surgery, so sometimes patients try to manage these things without surgery and use surgery as a last resort. All right, let's go through the nursing process as it relates to low back pain. The first step of nursing process is to assess and analyze. And so we are going to be looking for clinical manifestations related to underlying cause. Now, one thing you want to think about when you're talking about a patient with low back pain, what organ could be associated with our low back? If you said our kidneys, you'd be correct. And so you want to get a urine test on these patients because we want to rule out any kind of kidney pain, kidney injury, kidney infection that could be the root cause of the back pain. Nursing diagnoses. Nursing problems that we can work on and with patients with low back pain include acute pain, impaired mobility, and risk for impaired bowel elimination due to lack of mobility. Nursing interventions. Remember, with nursing interventions, it's what are we going to assess, what actions are we going to take, and what teaching are we going to do. So for assessments, we always want to take a full set of vitals, assess their pain, assess their mobility, and any limitations they're having with that. Talk about what was happening when this first started. We want to assess for any numbness and tingling to see if there's any nerve impingement. And then we want to assess their bowel function because bowel function can be impacted anytime we're talking about the spinal cord. Now, in terms of actions to take, we're going to administer meds as ordered, encourage range of motion exercises, whether passive or active, and then increase fluid intake to reduce any risk for constipation. In terms of teaching, we want to teach the patient different low back exercises that can help them strengthen the back. And often, if it's the back that's involved and it's weak muscles, it's often the core muscles, like the abdomen and the obliques, that are impacted. And so then the back muscles are trying to make up for a weak core. So a lot of times when patients go to physical therapy for low back pain related to muscle injury, the physical therapist will actually work on core strength in addition to back strength. We want to teach the patients to take their medications as ordered. We want to talk about non-pharmacologic pain relief. Ice is always good in the first 3 days after an injury, and then heat after that. Light stretching exercises, keep walking, keep mobile, and make sure you're not lifting things that are too heavy for you. And if you are lifting, to use proper body mechanics to do so, using your legs and not your back to lift heavy things. And then finally, the more weight we have on us, the more our backs have to carry. And so teaching weight control methods will help the patients over time as well. And finally, how do we know if it all worked? How do we know if we can evaluate our care and if it was good enough? Well, the patient should be able to resume normal functioning, and the patient should be able to reduce the risk of re-injury as they strengthen those core muscles and learn proper body mechanics to keep those injuries from happening in the future. And that's going to wrap it up for our lesson on back pain. Thanks so much for listening, and I'll see you in class.